Hello, I'm Dr. Anil Kumar BT. I'm a consultant nephrologist and a transplant physician working in BGS Gleneagles Global Hospitals for the last 10 years. Chronic kidney disease, like coronary artery disease, is a major burden to human mankind, and diabetes is one of the important cause of chronic kidney disease. Compared to the global perspective, in India, diabetes is the main cause of chronic kidney disease. More than 50% of the cases of chronic kidney disease are due to diabetes. And knowing that India is the number one capital of diabetes, so the burden of diabetes on chronic kidney disease is very high. And we know that chronic kidney disease in India, how common is it? Every 1 in 10 of our general population suffers from some form of chronic kidney disease. Chronic kidney disease runs through 5 stages. Stage 5 is a stage where the kidney disease are functioning less than 15%. And it is also a stage where one needs long-term renal replacement therapy like dialysis and transplantation, which are the only two options left in that stage. Diabetes causing diabetic chronic kidney disease is through the diabetic nephropathy. So patients who are affected with diabetic chronic kidney disease compared to other chronic kidney disease, they progress very faster, and the time taken to reach from stage 1 to stage 5 is very rapid. Most often we see by around 12 months they reach end stage renal disease or chronic kidney disease stage 5. And patients, with the moment they reach chronic kidney disease, we don't have any options to cure this disease, and the only way to slow down this disease is control the risk factors, controlling diabetes, controlling hypertension. So the best way of preventing this burden is to prevent patients developing diabetes by enhancing or encouraging lifestyle modifications. The chronic kidney disease, when it reaches stage 5 or when we reach end stage renal disease, the only two options for supporting this or the replacement options are dialysis and transplantation. Dialysis are two methods, long-term hemodialysis or peritoneal dialysis, and transplantation is the preferred option when we compare to dialysis, whatever the age may be, whatever the cause of chronic kidney disease it may be. So for the main challenges for in India is the availability of the donors, the infrastructure what we have in India, and also the cost factor is these are the main challenges. And lastly, the other challenge is the legal hurdles, which especially in India, when we compare to the rest of the world, the legal hurdles which one faces to undergo a transplantation is immense. So sometimes preventing them to undergo a kidney transplantation. Compared to the global perspective, in India, the present scenario is there is a first degree relative donor. So what I mean first degree relative is a father, mother, brother, sisters, or a spouse. So the things are straightforward. So even in this situation, it takes for an individual at least a 1 month period to arrange his legal documents before he undergoes a transplant, though his medical workup is ready. But whereas in the rest of the world, especially in the developed world, it hardly, once the medical workup is over, he can go ahead with the transplantation. Now, other challenges are for the donors here in India is we should, if there is no first degree donors, then transplantation is either not possible or he has to or be on a waiting list for deceased donor kidney transplantation. That usually takes around 4 to 5 years. For a patient who does not have a donor, then unrelated transplantation is considered a crime. So though the legal documents what we have, the legal rules what we have as per the Toha Act, it says that unrelated transplantation is not a crime, or we can't do unrelated transplantation, but it has to go through appropriate measures. But whereas all here we face, all people come with forged documents, and at the end of the day, the doctors are held responsible for any mistakes or any for forged documents by the patients or the patient's family. So the government, I feel that if they come across with some stringent criteria and some policies in place, so the doctors, if they are not held responsible, they are only responsible only for the medical management, then transplantation would be much easier. So considering this, the legal challenges what we have as of now in India, we are left up with doing only compatible transplantations, that too are first degree related transplants in India. Otherwise, they have to be on a deceased donor waiting list. Deceased donor transplantation in India, so far it has improved, no doubt, from because basically because of the media awareness in the last couple of years. But still, it has to go a long way when we compare ourselves to the developed nations. But having said this, so there nowadays we can still do much more transplantation by doing high risk transplants, where the ABO incompatible transplantation has come up a long way. By doing ABO incompatible transplants, the success rate is as equivalent to ABO compatible transplants, and we can do transplantation across cross match positive patients. The pediatric transplants numbers have increased of lately, and also the awareness among the common public, where the earlier when the word transplantation means something, it is not possible, and the surgical expertise has improved, and with better immunosuppressive medications, the transplant numbers has really increased. Nephrology, 5 years from now, is mainly we should focus on prevention. Prevention is the main key because, as I told, CKD burden is increasing, diabetes is increasing, so the management of CKD is also improving, so that we will be finding more and more patients suffering from this chronic kidney disease. So more and more of patients developing complications because of chronic kidney disease. The risk of coronary artery disease is increasing. So the main role for us for now, for the public, the medical fraternity, is to preventing the risk factors of chronic kidney disease, preventing diabetes, preventing hypertension, and following the lifestyle modifications, we can definitely tackle the problem of chronic kidney disease. In the same way, the renal transplantation is the best form of treatment as of available as of today, and so we have to improve the challenges what we are facing right now in kidney transplantation, coming in terms of mainly legal issues in India, and also improvising the standards of transplantation.